I'm Janet Moyers. My exposure to nurses has been on several fronts. I am a mother, so I've been in the hospital for deliveries. I have had a serious accident and multiple surgeries on my knees and my wrist. And I am a lawyer, and I practiced medical malpractice defense work and had extensive dealings with lawyers in the legal setting. I think the one word I would say is my image of nursing is caregiver. I think that that's important on a lot of fronts. I think it's important to the patient. I think it's important to the patient's family. And I think it's important to the hospital, because I think that nurses are the true ambassadors of the hospital when it comes to personalized care as opposed to surgery or treatment by a doctor. One of the positive ones that goes back to my most happy memories is for the delivery of my children. When my first child was born, the nurse was very helpful, very personable. There are a lot of unknowns when you're delivering a child about what you're going to do, how you're going to handle the child, can you breastfeed, and this nurse was there from the delivery all the way through my discharge. And I specifically made sure that she was on call 2 years later when I had my second daughter, so that I could have the same nurturing experience and guidance. I have two large negative impacts. First one, I had an accident years ago and was hit by a truck as a pedestrian and blew out both of my knees and my wrist, and had multiple surgeries on my knees. In the first surgery, I was just waking up in the hospital room from surgery, and I was hooked up to a morphine drip, and I had been pushing the button and it was not working, and it was a male nurse, and he came in and he said, "Oh, it's working just fine. I've got to move you over," and picked up one of my legs and moved over. I about reached the ceiling and scratched the paint off the top of the ceiling. I was in such pain. I said, "This is not working. There is no morphine coming out." And he said, "Oh, yes, it is. You've just pushed the button too many times, and it'll push it again when you need another dosage." Well, he waited in there for a while, moved me, and moved the other leg, and it did not come. And I said, "You need to look at the machine, because I am not getting any morphine." He looked and he said, "Oh, you're right. This is broken. It hasn't been dripping." I said, "You need to go get another one. You need to get it quickly. And while you're down there," because he said it was a few floors down, "get 2 of these so that we know the battery isn't dead in the second." He went down, came back, got another one, hooked it up. It did not work, but had not gotten a second. And so by that point, I was in such pain, I was almost out of my mind. The second one had to do with the same hospitalization, where because of my injuries, I couldn't bend my legs, I couldn't get up, I couldn't use my right hand, and I had to go to the bathroom. I know the schedule in hospitals is such that you can't expect immediate attention all the time, so I would never wait until the last minute to ask for help or the bedpan, but I did push the button. The nurses answered. I told them I needed to go to the bathroom. Could hear them all out at the nurse's station talking and laughing and hee-hawing. Waited, and I very deliberately sort of watched this. For about 15 minutes, nobody came, so I buzzed again, and then nobody answered the buzz. 30 minutes later, nobody was answering the buzz. I could still hear them all out there, so it wasn't that people were otherwise occupied with patients. And so I ended up getting the hospital phone, calling for an outside line, called in through the operator to the nurse's station on that floor, and asked to send somebody to my room so that I could relieve myself. I think the role of a nurse as a caregiver is the first thing, and I think that nurses need to understand that it is their exposure or patients' exposure to nurses and to the nursing skills and to the warmth of a nurse that makes or breaks the patient's experience. If you're there just to do a job and you're treating somebody just like a piece of paper that's on your desk that you have to finish and move over to the other side, that comes through to the patient, and I don't think that that is helpful. And I think if there is empathy for the patient and their situation, and realizing that in many times they are helpless to help themselves, that doing that is a great service to the patient. And I remember, in conjunction with my same leg surgeries, that I had been in the hospital for 5 weeks, I guess. Still could not do anything, and one nurse came in one day and she said, "You know, Janet, I have extra time this afternoon. Would you like it? Would it be okay? Would you like it if I shaved your legs?" And I will never forget that nurse, her name, her face, or the thought that she was thinking about what I was doing there. And I had so many doubts in my mind about what I would be capable of doing or not doing, and the fact that somebody cared enough to say, "Can I shave your legs?" was touching to me and made me feel better about everything.